Hi, my name is Maggie Shelton, and I'm in the first cohort of the microdosing facilitation training and feel very lucky to be there. I decided to take this training because I have been microdosing now for about a year and a half, off and on. And I am also a psychotherapist. I'm a licensed clinical social worker in California. And I've had clients come to me who are microdosing. And that combination of things said to me that it was time for me to learn more. And I have been learning more. I want you to know this. As a clinician that has been in practice for 35 years or more, I've taken lots of trainings of many kinds. And I have to say, this stands out as among the best I've ever taken. They hit legal and ethical, they hit process-oriented stuff about how do you sit with people and have the kind of conversations that are a part of microdosing facilitation? What is preparation? What is integration? How do you approach microdosing itself? And the the lectures on neurobiology have really been outstanding. It is something I know a decent amount about, and believe me, I have learned. I really appreciate that. There was a lecture recently on working with folks that have been abusing substances and the impact of doing that was really inspiring. All of the presenters have been quite inspiring. Some of what I particularly appreciated was a historical and anthropological look at the use of what we now consider medicines that have been integrated in many, many, many cultures, I think virtually all cultures before ours. And that historical grounding is very important. This is this is something that has changed my own approach to microdosing. I think prior to this class, I didn't take it as seriously as I do now. In one of the early classes, there was discussion about setting an intention every time one doses. I've kept a journal with it, and I've had some intention for sure, but one of the ways that my microdosing has changed is that I am setting those intentions in my journal daily, regardless of whether I dose. And that's making a difference in my days. I would say that it's also making a difference in my meditation practice, which is something I've done for a very long time. And right now, I think that the combination of microdosing, meditation, and the way that we have been taught to approach microdosing is deepening my meditation practice in ways that I find very satisfying and important, and is opening up a lot of creativity and possibility for me. When it comes to my work, the information that I bring to talking with my psychotherapy clients about their use of microdosing is much better informed, and I have lots of resources I can connect them with to understand questions that they might have about how microdosing is going for them, about if they are taking any kind of medications, particularly psychotropic medications, what the implications of using any kind of psychedelics might be for them. So that's very important. And I look forward to being able to offer microdosing facilitation for people that are also struggling with things that they might otherwise bring to a therapist, so that that combination of services can be something that I offer. So I have to say that I am very pleased to be a part of this class, and it is truly changing my life, both personally and professionally.
Thank you, Maggie. That was beautiful.